Welcome to the We Talk Health Podcast, the official podcast for West Tennessee Healthcare. Please be advised that this podcast is not intended to replace any medical advice. Always follow your medical professional's advice and direction. Nothing said in this podcast is intended to supersede or supplement the direction of your medical caretakers. If you have any questions, please reach out to us at wetalkhealthpodcast@gmail.com, and we will do our best to answer any questions you may have.
Welcome to another episode of We Talk Health. My name is Will Kwasigroh, and joining me in the studio today is Dr. John Baker. He is the Chief of Cardiology for West Tennessee Healthcare and is here today talking about his cardiac heart failure clinic. So, Dr. Baker, first and foremost, how are you?
Good. How are you?
I'm good. Thanks for coming in and being willing to take some time to talk about the clinic.
Happy to.
So first off, before we dive into the clinic information itself, I want to get to know you a little bit better. So tell me about yourself. What kind of doctor are you? Where you went to school? About your family? Favorite sports teams? Just help me get to know you.
Okay. Well, I was born and raised in Big Orange Country, Knoxville, Tennessee.
Go Vols.
Yeah, go Vols. That's my team.
Nice.
I went to school at the University of Tennessee, Knoxville for my undergraduate year and did 1 year of graduate studies before I entered the University of Tennessee Medical School at Memphis. I graduated from Memphis in 1990. I've been postgraduate training at Wake Forest University in North Carolina and also at the Medical College of Georgia in Augusta, Georgia.
Okay. So you've stayed in the South for all of your schooling.
Yes, that's
Southern
true.
boy. Nice. Awesome. So I know your title says FACC. Can you kind of tell me exactly what that is?
That means I'm a fellow of the American College of Cardiology.
Okay.
To become a fellow of the ACC, you have to be board certified in cardiology. I have double boards, both in cardiology and interventional cardiology.
Oh, that's amazing. It's impressive. Okay, so like I said, we're going to be talking about the CHF Clinic, the Congestive Heart Failure Clinic. Can you kind of tell me exactly what the clinic is, what it treats? It makes sense, congestive heart failure, but what else, I guess, is my main
A
question.
lot of people ask, what is congestive heart failure? It really is a misnomer. When you label somebody with congestive heart failure, they think that's a death sentence. It's really not. It's a chronic disease condition.
Okay.
A better description would be ventricular dysfunction. The heart doesn't work as efficiently as it should.
Okay.
And that can come from a variety of reasons. Most commonly, coronary artery disease causes impairment in the muscle of the heart and lowers the overall efficiency of the heart's pumping function.
Gotcha. Okay. So I've heard that once you become a heart patient, you're a heart patient for life. Is that accurate?
That is accurate. Coronary artery disease and congestive heart failure are both chronic medical conditions. People can live quite well, have very productive and enjoyable lives with these conditions, as long as they're under the appropriate care of a physician and taking the medications as prescribed.
Following the doctor's orders, basically.
Exactly.
Do you guys work with the cardiac rehab
Yes, we do.
department? Okay.
Yes, we do. The
Gotcha.
cardiac rehab has actually a congestive heart failure portion as well as the portion for the patients that have had heart attacks.
Gotcha. Okay. So where is the clinic?
The clinic is at 587 Skyline Drive, just across from the hospital.
Okay. That's easy enough to know, easy enough to find it. Putting it in Google will take you right there.
Oh, yeah,
Gotcha.
definitely.
So do you have to be referred to you guys by a PCP?
No, we take all patients whether by self-appointment or by referral.
Okay. That was my next question. Self-appointment can work. Are you currently accepting new patients?
Yes, we are.
Okay. And what is the contact information? Do you have a phone number or?
Our office number is 421-6510.
So yeah, I'm not clinical. I have a degree in music education, and I know how to push buttons and record on a microphone. So can you kind of just dive in a little bit about what congestive heart failure is?
Okay, congestive heart failure, like I said, is a chronic medical condition. It is dysfunction of the heart. Usually, the signs and symptoms are shortness of breath and swelling, predominantly swelling in the lower extremities or wherever gravity takes fluid. Because the heart is inefficient in pumping, it doesn't clear the fluid from the lungs as well as it should. It starts a whole cascade of neurological and hormonal events that cause the body to retain excess fluid, and then they get into trouble.
Gotcha. What would cause that? Is it just lifestyle choices?
Most common cause of congestive heart failure is ischemic heart disease or coronary artery disease. People that have had heart attacks lose some of the function of their heart after that heart attack. And people that have had multiple heart attacks obviously lose more function of the heart. That's the most common cascade, but there's a variety of different ways that it occurs, and probably more than anybody wants to know. It's not a cardiologist.
Gotcha. Okay. Well, perfect. Well, thanks so much for coming in today. I know it was a very quick podcast, but we just wanted to shed a little bit of light about what the CHF Clinic is, where it's at, and good to know that you guys are accepting new patients should anyone need to give you a call.
Yeah, that's right. Give us a call at 421-6510.
Perfect. Well, Dr. Baker, thanks so much for coming in. It was great to meet you. And this has been another episode of We Talk Health.